Hello, guys, and happy Workers' Day to you all. So, today I'm going to talk about some of the things that pregnant women experience, which are a little bit unpleasant, but which no one tells you until you experience it. And this is I'm just also going to tell you that this is not to scare you. This is just to get you informed because it's quite common, and many pregnant women would experience one or two of these, and they still go ahead to have a healthy baby and a normal birth. So don't be scared, but just so that when you see it, so you don't feel like you are alone or something like that. So guys, don't forget to subscribe to my channel because it helps grow this channel and I will continue to bring you useful content. So some of these symptoms I experienced during my first pregnancy, and I still went ahead to have a normal delivery and a healthy baby. So don't get scared. And if you see me looking down, I have a little paper where I wrote down those points I want to talk about. So let's go straight to the points now. Most of these happen during your third trimester. Because for me, I think that's the most difficult part of the pregnancy. I don't know what other people's opinions are, but that's just for me. So the first one I want to talk about is swelling. So during my first pregnancy, I didn't really have that much of a swelling, but of course, sometimes, your shoes get so small for you. Your nose is swollen, or kind of your face, you just look a little bit swollen. Some people have swollen legs, and that's quite normal, especially in your third trimester, because when you're pregnant and during your third trimester, that's when your hormones really uh, are really high, and it could cause like water retention. So when you have water retention, it could lead to swelling, but this swelling will just fade away naturally when your baby comes. So you don't need to worry about it, except there is something else uncomfortable about it. Then you can talk to your public health nurse or your midwife or your doctor, whoever you are in contact with in the course of your pregnancy. But don't get scared. It's normal and it happens to quite a lot of women when they are pregnant. So the second one you could experience is a discharge. So I know many people don't want to hear about this, but it's good to know what kind of discharge to experience when you're pregnant, so that you know what is normal and what is not normal. But usually during the first trimester, um you have discharge. It's usually clear and is not as much. But during your second trimester, then this discharge increases in quantity. Like it's really much, it increases in quantity. And but you are not supposed to experience any itching or foul smell, you know. But during your first trimester, you are prone to having um, yeast infection, and it can also be as a result of the hormones springing up. So when you have an unpleasant discharge, maybe you're itching so much and you're having a discharge that is not that is like a thick um a thick mucus that is like yellowish in color, and you're itching and it's smelling. So you need to contact the hospital or your midwife, so that they can run a test, take a swab and see what kind of infection it is. And if it's a yeast infection, they are definitely going to prescribe something for you to use. For example, canesten cream is prescribed if yeast infection is detected, and that's also quite normal. Most women have it, and that's why, for example, I don't know how it happens in other countries, but in Finland, when you are pregnant, each from the second trimester, that's usually when you have more of appointments with the public health nurse. So each visit you have to submit your urine sample, and you know that you have to hold the urine for at least 2 hours, and then you submit your urine sample and they check on each visit if you have any urinary tract infection, because urinary tract infections can be dangerous during, or it's unpleasant during pregnancy. So they usually check it during all of your visits. So, guys, during your third trimester, now the discharge changes. It becomes, sticky and slimy. Perhaps because your baby is getting ready to come out. So, those are the three different kinds of discharge you could notice during your first, second, and third trimester. So another thing that women experience during pregnancy is gestational diabetes. And this is diabetes that occurs when you're pregnant. So that doesn't mean that you're going to have diabetes for the rest of your life. So don't be scared. And this gestational diabetes is usually has something to do with genetics. So, and when women, usually the recommend the test if you have, risk factors of gestational diabetes. And usually you go for a glucose test in the laboratory, and it takes about 3 hours because when you arrive, they take your blood samples and they give you a glucose. They give you about 75 mils of glucose to drink, and then you have to drink it within 5 minutes. And after then you go to sit down. After 1 hour, the lab technician calls you again back, and they test your blood sugar again. So they want to know, how much your blood sugar is after 1 hour, and then you do repeat it again. So it takes about 3 hours, and if everything is normal, then it's okay. Congratulations. But if you have gestational diabetes, then it's not a good sign, because it could affect the baby. So they have to, try to manage it and put you on a diet that you would eat, so that you don't eat excess calories. So that's about it. I personally have not experienced it, so I cannot talk from experience, but that's what I know that they do if you have it. Yeah, so that's about that. So the next thing that is common during pregnancy is itching. So it's very normal to itch during pregnancy because your body is stretching, and the hormones as well, they cause a lot of things. So itching is very normal until it becomes unbearable. So when it becomes unbearable, for example, you're itching in your palms or the sole of your feet, then and it's unbearable, you can't sleep, it's affecting, your daily activities, then you have to make a call to your doctor or your midwife or your public health nurse, whoever is in charge. So you have to make a call to them because they need to rule out cholestasis. They need to rule out that the cause of the itching is not anything harmful. So cholestasis happen when your liver cannot process the bile. So the bile builds up and goes to the bloodstream, and that is what causes the itching. So that is why I said, like, not all itching. So when this itching comes, you will know that this is a different kind of itching because it will affect your daily activities. It comes mostly in the palms and in the soles of the feet. Sometimes it's all over the body, but it definitely, affects your daily life. That's when you know that this is not normal anymore and you need to go to the health center to check if everything is normal. And usually, if you have been diagnosed to have cholestasis, it becomes a risk pregnancy because that buildup of bile could affect the baby, and it's possible to have a stillborn. So that's why it needs to be treated. And usually in Finland, one of the medicines they prescribe is Adorsal. So this is the medicines they prescribe that you take 2 times a day, morning and night. You take either one or two, depending on how severe the itching is. And it's usually with doctor's prescription and it's usually very expensive. I think it costs about 95 euros for this, and it finishes really quickly because if you have severe itching, you could take about 4 tablets a day. So that's about it. But anyway, when you've been diagnosed of this, you need to go on a regular, checkup. They need to check your liver to see that your liver is fine. And most times your liver is fine. It's just the pregnancy, and it is caused by the hormone estrogen that is springing up. And yeah, so another thing you have to also, since you're taking this medication, you also have to go for a regular blood test so that they will continue to test the level of the bile in your blood. So they continue to test it. And sometimes they can induce your pregnancy earlier than it should be if there is a high risk so that they can save the baby. So, but sometimes also, you go ahead to have the baby in the normal date. But one thing is that you would not exceed your date, the date they gave you. They won't let you exceed it if you have this condition. But most people that have this condition, they go ahead to have a normal baby and no stillborn. At least here in Finland, I have seen a lot of it, and most of them have normal baby. Just get it treated and don't be scared, everything will go fine. So the last one I want to talk about today, because I don't want this video to be lengthy, is stretch marks. So after my first baby, I didn't have any stretch mark from pregnancy. And, I would advise that you moisturize your skin very well. But for me, I used this Pregnant Care, stretch mark cream. That's what I used on my tummy throughout my first pregnancy. And I think it really helped because after having my baby, I didn't have any aftermath of pregnancy in form of a stretch mark. So I would advise that if you don't have access to this, because this is the one I've used and I trust. So I can't recommend anything else that I haven't used. But I think daily moisturizing of your skin would also help minimize the appearance of stretch mark. So that's where I'm going to end the video today, you guys. Thank you for listening. Thank you for subscribing. And thank you. Bye. See you next time.